as a series of antibiotic, we continue our speaking about or our talk about the carbapenem or about the antibiotic. We cover the penicillin and cephalosporin. Remaining to talk about the beta-lactam antibiotic. Other beta-lactam antibiotic, we have carbapenem and monobactam. And in this session, we are going to cover these two a group of medication. As you can see with the S, indicate to the group of medication belong to this group of antibiotic. We have carbapenem and monobactam. So what we have here, we have for carbapenem, we have four medication: imipenem, meropenem, ertapenem, and doropenem. Regarding the monobactam, we have only one medication, azithromycin. So we have the beta-lactam ring here. So for this reason, we call this one like beta-lactam antibiotic. So for beta-lactam antibiotic, we have, if you remember, we have penicillin, we have cephalosporin, and then we have carbapenem, then we have monobactam. So we have four main group of medication belong to the beta-lactam antibiotic. Okay, so start with the carbapenem first. Here to remind you again, the beta-lactam antibiotic mainly inhibits cell wall synthesis of the bacteria. Again, this one here we already covered penicillin, cephalosporin, and now we are talking about the carbapenem and monobactam. Okay, we have it here again under the umbrella of beta-lactam, and now we start talking about this medication, carbapenem. This is a group of medication prescribed intravenous (IV). This group of medication will penetrate into the body tissues and fluid, even to the cerebral spinal fluid. The issue here we have, as we mentioned before, if you go back to the list of the carbapenem, you can see the list of medication here. We have imipenem, we have meropenem. Let me remove the, okay. So as you can see here, we have imipenem, meropenem, ertapenem, doropenem. What happened? This is the first medication in the group, the first medication, imipenem. Okay, what they found later on when they start using this medication, they found in our body we have enzyme found in the proximal renal tubules, and here we are talking about the renal. So in our body, in the renal, in the kidney, we have enzyme called dehydropeptidase. This enzyme responsible for metabolism of imipenem. So so what happened here? We have imipenem prescribed to the patient, IV, for treatment of infections, but in the kidneys, they found, or renal, we have enzyme dehydropeptidase enzyme, and this one responsible for metabolism of imipenem. When you say metabolism, that means in general destruction of the antibiotic. So we try to figure out how we can protect imipenem from metabolism. So this is number one. Number two, the metabolite coming from this process. So we have enzyme metabolites the imipenem, and this will produce toxic metabolite. Okay, so you can see here that this metabolite could be considered like nephrotoxic substance. Okay, so we have two reasons now to protect imipenem from metabolism by the enzyme. Number one, we need to keep the activity of the antibiotic. We need to maybe expose the activity, number one. Number two, we need to prevent the toxic effect. So we have two purposes of preventing metabolism of imipenem. For this reason here, we combine imipenem with the cilastatin. So cilastatin considered like a substance that inhibit the enzyme called dehydropeptidase. So cilastatin inhibit the enzyme called the dehydropeptidase. So when you prescribe cilastatin, okay, cilastatin inhibit the enzyme called dehydropeptidase. This will keep imipenem as a parent parent drugs, and this medication will be produced there. It's active and prevent the toxic effect as maybe metabolite nephrotoxic effect. Okay, the imipenem used for patients suffer from urinary tract infections. Some patients may suffer from nausea, vomiting, diarrhea. Okay, the high level of when you prescribe high doses and this will achieve high level of imipenem in the blood, this may cause seizure. So for this, we have now the situation now. So imipenem, we have two things, two drawback, two negative point for imipenem. Number one, from imipenem, I will repeat it. Number one, only with a different color. Try to choose different color. I will go with a different color here. Okay, this one here. Number one, this medication destroy or metabolized by the dehydropeptidase, and we try to solve this problem by adding cilastatin. And in this case, we extend the action of imipenem and reduce the nephrotoxic effect. Number two, this is a first negative drawback, negative or drawback aspect. The number two negative or drawback aspect, this medication imipenem may cause seizure. Okay, for this reason here they developed medication called meropenem. So the meropenem number two here, 1, 2, 3, 4. Okay, meropenem number two here. Okay, so meropenem, we have two advantages. Number one, is not metabolized by dehydropeptidase. This is number one. Number two, this medication does not cause seizure. So we have two advantages for meropenem if you compare it with the imipenem. So number one, not metabolized by the enzyme in the proximal renal tubules, and there is no risk of nephrotoxicity. Number two, this medication meropenem does not cause seizure. Please remember, these medication prescribed IV. Okay, so the situation here, if you go a little bit to the slide to look what we have here. So they said imipenem, cilastatin, meropenem are the broadest spectrum beta-lactam antibiotic. So the question, which of the following medication or beta-lactam antibiotic considered like broadest spectrum? So we have imipenem, cilastatin, one medication, or meropenem. Broad spectrum. So as you can see here, I'm not going to say all these names. All these bacteria will be covered by the imipenem, meropenem. So for this reason here, meropenem, imipenem considered like broadest spectrum antibiotic. Okay. Again, broad spectrum, imipenem, meropenem, broad spectrum antibiotic. Imipenem resists hydrolysis by beta-lactamases. So we can prescribe for the bacteria produce beta-lactamase enzyme, active against the gram-positive, active against gram-negative, active against anaerobes bacteria, and Pseudomonas bacteria. This medication could be used for empiric therapy. So when you prescribe some medication, it's not active, this will be the alternative, or you can prescribe it without the blood culture or cell culture or like tissue cultures. So we already covered that meropenem does not undergo metabolism, and there is no risk of nephrotoxicity. Okay, so we're done with that first group of medication. We have carbapenem. Carbapenem, we have 4 medication, imipenem, meropenem, ertapenem, doropenem, and I would like to share with you some maybe. Okay, as you can see here, we have imipenem, cilastatin injection, and this belongs to the other beta-lactam. So you can see the combination between imipenem and cilastatin. Moving to this another medication in the group of carbapenem. Okay, so we have meropenem injection here. For example, you can click on this one. Okay, meropenem injection, again, this one here, meropenem injection. Okay, but again, this group of medication considered like broadest spectrum antibiotic, cover most of the bacteria. Okay, the next medication, we have it here. We have the Monobactam. We have one medication. We have azithromycin active against the Enterobacter, plus some negative road bacteria. This medication lack activity against the gram positive, no activity against the gram negative, no activity against the gram positive. Sorry about that. Then they said, okay, this medication mainly active against the gram negative, especially about the Rhodes bacteria, and we talk about Enterobacter. For this reason, we consider this medication narrow antibiotic spectrum. So now we have two things. We have broadest spectrum antibiotic, then we have narrow spectrum antibiotic. So for the broadest, remember imipenem, meropenem. For narrow spectrum, remember azithromycin. Azithromycin belongs to the Monobactam antibiotic. Okay, so this medication may cause phlebitis because it's like IVIM, Monobactam azithromycin, may cause increased liver function enzyme, safe to treat patients with who suffer from allergy towards penicillin. So that will be maybe alternative option here. If the patient suffer from allergy towards penicillin or cephalosporin, this is alternative maybe medication. But we need to look on the what type of bacteria we are having there with the patient. So for this reason here, we have to consider azithromycin as alternative for penicillin and cephalosporin against the Enterobacter, against the gram negative roads. Here is the key word for the azithromycin. I'm sharing the screen from Google Image regarding the azithromycin. Again, we need to remember azithromycin belongs to the beta-lactam antibiotic. Azithromycin narrow spectrum antibiotic, mainly affect gram-negative roads, especially Enterobacter. So you can see the azithromycin available for the injection, IVIM.